We're going to work our way up the spine first, but when you come back to a foot, it's always worth just doing a few of these downward strokes. Okay. Just to maintain that mobility. And here, you're just gently pushing your thumb and then pushing in. So it's like a caterpillar. You're pushing up and in, and it is a tiny, tiny movement, and you really don't need much pressure at all. And this is just working our way up the spine. Okay. And then we come back down. Okay. Sometimes you can feel a small crystal. That's actually a build-up of toxins. The feet are reflecting the body. So it's normally the case that if you found a crystal in the foot, say in the spine, it would mean that there's tension in the back. So by breaking the crystal, just with gentle massage, you can circle or just carry on doing this thumb walking. It will allow the body's natural energy to flow freely through the body. So you're removing tension in the rest of the body. Feet do reflect the body. Just working up the spine. This is the lower back up to the neck here. Okay. Should take a bit of care when you go across here. This is sometimes very tender. So you can just release off the pressure at that point. And we're just going to work around the head. So that's the big toe. We're going round here, and then just change your grip. Thumb walking does take some practice, but once you've got it, it's very easy. If you're not happy using your thumb, you can use your forefinger. Actually not uncommon to feel crystals around the big toe. Okay. So we're just going to work down the head. So you're holding one hand behind the toes, so you're pushing on your own hands. You're not pushing on the foot. You're using your hand. And then change hands and come back. Ideally, you want to do 5 lines down the toes, but if you're working on a child or somebody with smaller feet, 3 or 4 is fine. But if they've got big toes, go for 5. So we'll move on now to the sinuses. Once again, place the hand behind the toes and just gently circle the pads of each toe. Now, this is where some people might find that they're rather ticklish. If they are very ticklish, it's not worth doing it. Just move on to the next exercise. In time, they probably get used to the feeling, but just a little and then come back to it. Because ideally, you want the person to relax as much as possible. And throughout the whole treatment, you want to encourage that. Make sure they're warm enough. If you're working inside, it's worth covering the foot that you're not working on, and then uncovering it again when you begin to work on the foot. You can just cover it with a towel or something. Okay, I'm going to work across the shoulder line here. And all the way across. We've also got ear, nose and throat along here. And then going down here. And then round this pad. So this here is the shoulder. There's some tension here, and you can normally feel tension in this area. And you just gently circle it. So you place your thumb on and just gentle circular movements. And then we work our way back. We're just going as far as the big toe. And then coming from the big toe, once again with this thumb walking, round here. And you can feel there's a natural pad here. You'll find that in the foot. And then we'll come back across. Now continue with the thumb walking, drag the thumb back and continue again. And then drag your thumb back. So this is working on the chest area. So we're working on lungs. And you can normally tell if somebody's got a cold, or maybe if they're a smoker, because this area will be congested. Back across towards the big toe. You can do this a few times. Okay, we're just going to work round this pad here. So you just follow a natural path, really. It really doesn't take long before everything appears logical and you think, yeah, that's right. You know when it's right because you can just tell you're not working against the foot, you're working with it. You're going round here, round in that shape. This is all thyroid area. It's not uncommon for the person who you're practicing on to actually feel pain. You're not applying much pressure, but you can feel pain in the foot. And just ease off the pressure and maybe come to a circular movement around the area where the pain was felt. And then go back to thumb walking. There's no point trying to break up every crystal you feel the first time. You'll be releasing all the toxins back into the bloodstream, and you just take a bit of time. You can always come back and continue to work. Okay, we're going to work across the diaphragm, which is across here, with the solar plexus is in the middle. So we're just working all the way across. And coming back. And it's much easier to work on the feet. You can work on the hands if somebody's got a foot injury, or even if they've got a verruca. But the foot's much more accessible, and she fits very nicely into the hand, and then I'm just going to circle here on the solar plexus, and we go back across. Sometimes if you feel a bit jittery or you have the butterflies, it's worth just gently massaging here, and that will help relieve that. Okay. And I'm just going to work across the internal organs. So we've got the liver on the right side, stomach on the left. So we're just thumb walking across 3 times, sliding back, and on the third one sliding down diagonally. So again we're walking across. 1, and then diagonally up. So again, so here we are. And most things you do work them in 3s. 2, 1 more, and then we slide diagonally down and across, back, and diagonally up. Okay, at any point during the treatment you can come back to these effleurage relaxing moves, and it's quite nice from time to time just to come back to a couple of these just to maintain contact and just to keep the foot nice and relaxed. And we go on to the other one. So I'm now going to work around the intestines. Okay, so we have both feet this time. You're holding at the toes, and we're working up and along, so we're actually following the path of the intestines, and then moving on to the other foot, picking up where you left off, moving across, down, and then round. Okay, and again, so we're going up, and it's very important that you work this way round the intestines, because this is the way that they go in the body. Okay, and again, so you must start on the right foot, then move on to the left foot, go across, down and round. Okay, so we're going from the kidneys down to the bladder, so we're working down and then slide up. We're walking down from kidneys to bladder and slide up and up, and again on the second foot. So we do all of these. Okay, and then we're coming back to the first foot to work across the sciatic nerve, which is just about here. We're going across, and then you're coming back. And across, and back, just with the thumb walking. And across, and then you're coming back again. Okay. The last thing on the base of this foot is the muscles in the bottom. So you're just literally working around here, this lower back pelvic region and muscles. Okay, do this a few times. And then before moving on to the other foot, some effleurage movements again, so we're going down and up. And you can come back to any of the relaxation movements. This is perhaps one of the nicest ones to do. Okay, so moving on to the left foot, beginning again with the effleurage movement. So you're going down, you're coming around the ankle and pulling up. Okay, that's just nice because we've been working on the right foot, it just wakes up the left foot. Okay, and coming back to the spine. So it's exactly the same as we did on the right foot. We're just gently walking up, pushing the thumb up and squeezing in. So it's a thumb walk. Okay. And this side represents the left side of the spine, because we're mirroring the body and the feet. So we start with the lower back, onto the tailbone and coccyx, lower, the middle, and the upper back, and then you've got the neck, which is just here. And you'll probably find that this line down the foot actually reflects the person's spine. So you might find that if someone's sticks their chin forward, that this here is slightly inward, or if they have a bit of a hump or they slouch, you might find that something's reflected in this area of the foot. And then moving up to walk around the head, you place your thumb between the two toes and continue to walk up with your thumb, going around the big toe, so you're lifting your elbow and then walking back down the other side. And you change, you place the left thumb between the toes and you pick up the right thumb. And we go round across the top. And then when you get to the bottom here, once again you change, so the right thumb goes back between the toes that way, and then we walk up. Sometimes you do get a bit tied up with your hands, but it really doesn't take long before there is only really one way to hold the foot, and you'll find that the more you practice. Okay, so this is the last time. And it's really quite common to find crystals around the head, especially if someone works hard, slightly stressed. Okay, and then we're walking down the big toe, so you place your hand behind the feet and you're coming from the top of the toe, walking down, and remembering that if possible you're going to do this 5 times if someone's toe is large enough. The reason why you do it 5 times is because we have 10 energy zones which run through the body. 5 of them finish in the right foot and 5 in the left. So we're working down the energy zones. Just about get 4 on Kerry's foot, maybe. And one more time. You've always got your hands behind the toes so that you're not pushing on the foot. Okay, and then once again we come behind the foot, and you're just working here on the pads of the feet, the pads of the toes. We're just circling here. It's a gentle movement. You have to take care as well if somebody has very sensitive nails. Some people this actually hurts. coming back to the shoulder line, so this time it's reflecting the left shoulder. We've also got ear, nose and throat along here too, which is reflective of the left side. We're coming around the natural pad and then just circling. And then of course we're going back along where we came from. And again across the foot, so we're just starting just after the big toe. So you're going across, you're walking down and round and then circle. If you find there's a lot of tension, this is the shoulder area, and you can change to the other hand and gently circle whatever's comfortable, and you can continue these movements. Just a tiny circle, a tiny movement. Okay, and then we're walking back. We're going to work the left side of the chest, and it's very important that you do not push too hard. Don't push as hard as you did on the right side, because this side contains the heart. So we're just going to work through it very gently. So not much pressure at all. It's just literally working across the chest. Okay, the heart's just about here. Literally, it's tiny pressure across the chest on the left side. You can apply more pressure here towards the top of the foot, and also maybe the second one you do, but then lighten off the pressure on the third and the fourth. Okay, and now we're moving back onto the thyroid region. We go round here. You go round the natural pad and then walk down it and slide up. So we're going down and sliding back up. And again, once again, 3 times. If you find that there's particularly a stiff part of the foot, just gentle circles on the area. If the person's feeling pain, ease off the pressure, but you can maintain a very gentle circle. Now to work across the diaphragm. And once again, with the solar plexus in the middle, you can circle on that area. If someone's butterflies, anxious, anything like that, gentle circles. So we move on now to the internal organs on the left foot. So this side is the stomach, predominantly the stomach. And the right foot's the liver. Once again, walking across, sliding back. On the third one, it's the diagonal movement down the foot. Walking across and sliding back. Sliding back, and then diagonal. Okay. And then just sliding down. Once again, you can go back to these relaxation moves, any of them, if you gently massage the ball of the foot at any time. If you wanted, you could work through the intestines again now, but it's not actually necessary because we've already done it. But if somebody does suffer from any digestive problems, it's worth doing them twice when you reach the same point on each foot. Now going across the sciatic nerve. Okay, and then the bottom, hips, pelvic region. Okay, and to finish the foot, once again, come back to the prayer-like movement. Okay, at this point we move on to the tops of the foot. Just start by just rubbing the tops of the foot to make sure that you've got enough of your massage medium on them, and honestly, it all helps with circulation. Okay, and then moving on to the right foot. On the top of the foot, you start by walking down the big toe, but this time we're actually doing the same movement but with your finger. Okay, the top of the foot slightly more sensitive, skin's a bit thinner, so you don't want so much pressure, and that's why we use the finger. Once again, you're aiming for five lines. You can actually just walk down all of the toes. Stimulating all of the nerve endings. Okay, and then you take your two fingers and we're going in between each of the toes, from the toes up to the ankle. So we're just going up here. Once again, three, four, and then do a fifth one. So we've got the 5 energy zones. You can get 5 in, and this again, it's very gentle pressure. You're not pushing too hard. And this area actually relates to the chest again. Just take some movements, and we're just going to massage the top of the foot. Okay, so I'm just using 2 fingers on each hand. Thumbs are behind the foot, just gently placed, and we're just circling, and take one hand at a time to just circle all around the top of the foot, around the ankles. More for relaxation, and just to make sure we stimulate all of the nerve endings. Make sure you cover all of the foot. If you feel any tension, just go back. down the heel, and then circle with your middle finger around the ankle. Then we take tiny circles as we go round. So you're working around all the sexual organs now. Just round, and then across here. Just circle around the ankle again. And take your two middle fingers, place them either side of the ankle, and then from here we're just going to walk up in a V until the fingers join, and then just slide them back down. Actually a continuation of the sciatic nerve here, so it goes across here and up there. So we're just working here. Sliding back down. Okay. And then to finish the top of the foot, you just take two fingers and we're just going to finger walk the whole of the area. And this is exactly the same as the thumb. You push a bit, move a bit, apply pressure, move a bit and apply pressure. You want to keep where you apply pressure quite close to each other, so you don't want to slip and then apply pressure. You want to try and keep them tight. So we just way up, just go as far as a big toe. Remember, not too much pressure on the top of the foot. And then just slide between each toe. Okay, then take hold of all of the toes and just gently circle them round. So they go around each way. Now take them individually, so just circle and then just pull. So you circle and pull, so you're just lengthening out. And we'll just do this twice. And then we go back to this Reflexology movement. And now we're ready to move on to the other foot. So once again, starting with these relaxing movements. And you're taking your finger to the big toe and walking down the length of the toe. Aiming for 5 times. Okay. You can actually use any of the fingers. Some people like to support like this. It's really however you're comfortable. And then between the toes. Walking down each toe. So we're just here. Each toe. And walking out length of the foot between each toe. So again, this is with the 2 fingers, spreading all the way up, sliding down. So walking up, sliding down, walking up, sliding down, and one more, and down. So again, do this a few times. We're going to take massage movements all over the foot with the first 2 fingers. So it's exactly the same as we did on the other foot. You find an area which is stiff, you can work there a bit more. Get the circling going. And to cover the whole of the top of the foot, the whole of the surface area. And round the heel, across the top of the foot. So, everything moving. And circling back, so coming back round the ankles. And then working with the middle finger, small circles all the way around. Across here, sliding back, so the fingers join in the middle and then slide back. And we go back to taking the 2 middle fingers either side of the ankle, just beneath the ankle, and we're going up in a diagonal line behind the foot and then sliding back down. So up behind the foot and sliding back down. Turn the ankle in a tiny bit so we can finger walk with the 2 fingers over the top of the ankle. And this is just a basic foot massage routine. There's lots more moves that you can do on the foot. You can do this with your friends, family, partners, to help relieve stress, help them relax and unwind, remove muscular tension, improve circulation. Also, it will aid lymphatic drainage. Reflexology is a bit like a service on your car. It tunes the body and rebalances the system. Just same movements. We've got the circling of the toes, and we circle the big toe and pull, and just pull, Just lengthen out, especially if your feet have been in shoes all day. Sometimes you find that your toes will feel a bit cramped up, or you might curl them under. And some people curl their toes when they're stressed and they tense this muscle here. So it's just nice to be able to lengthen the toes out. There we go. And then back to Reflexology. Then we'll take both feet, we'll go along the top, circle around the back, and just pull the heels, not too much, just to lengthen out the legs. Okay, so if there's any tension that we're storing in the backs of the knees, in the quadriceps, hamstrings, we can just lengthen out. It actually just feels quite nice to feel like someone's just lengthening your body. Okay, we'll ask Kerry again to breathe in. So fingers back, thumbs back on the solar plexus. Okay, and breathe in and out. And again, so you're just applying gentle pressure as they breathe in and releasing as they breathe out. And one more time, breathe in and out. Okay, after a treatment you must make sure that the person you've treated drinks plenty of water to help flush all the toxins out of the body.